Hey everybody, this is Tom Hanson from Integrity Physical Therapy. Today I'm going to be talking about sciatica, which is probably one of the more common problems that I have patients come in for. The reason that it's a more common issue really stems from the fact that it can come from a lot of different causes. It can be something that can be rooting from your lower lumbar, L4, L5 area nerve roots. It can be coming from your sacrum and where it meets your pelvis or lumbar. So those are the lumbosacral and the sacroiliac joints. We can also have compression under musculature, particularly a muscle called the piriformis that runs through our pelvis and hip and attaches to our sacrum. So very often when we're looking at sciatica, I tend to focus in on the sacrum and try to look at the movement mechanics, its positioning, and the musculature around it and how that's balancing out. The sacrum is actually very important because it's sort of a connecting point between our lumbar to our pelvis and our lower extremities. It's a connection between the two sides of our pelvis because we have two pelvic bones that come together. And it's a wedge-shaped bone. It's like an upside-down triangle. So it wedges into the pelvis and it provides a good, stable base for our spine. Because we have a vertical, upright spine and we walk on 2 feet, having that strong connection is very important. But it's also very prone to a lot of compression in certain areas. And that can also have it get sort of wedged into positions that are not ideal, and we don't get the best movement mechanics out of that sacrum. So what we're going to talk about today are some basics in terms of exercises, which are stretches and some strengthening as well, that you can do to try to help with some mild sciatica or be preventative for sciatica in the future. We'll talk about at the end if you have more severe problems going on. But what we're going to look at first is we want to look at the ability of these different areas to move effectively. So we're thinking lumbar spine, sacrum, pelvis. We're going to focus in on some movements that will kind of challenge that for you and see where you're at in terms of how much mobility that you have. So the first one that we're going to look at is going to be a cat and cow movement. And this is something you see very often in yoga. We're going to get into a position where we have hands directly under our shoulders, knees directly under our hips. And what I want to do is I want to start to arch my spine up towards the ceiling as I curl my head forward and look towards my knees. So I'm trying to round my back up towards the ceiling, and then I'm going to reverse it, looking forward, extending my neck, letting my belly drop down, and I think about rolling my pelvis like I'm trying to lift my tailbone into the air. And we're just going to work back and forth through that motion. I move pretty slow so I can get a feel for if there's certain areas in my spine that feel more stiff than others. So we would do about 10 to 15 repetitions of that cat and cow movement. So the next one that we're going to look at is going to be more for our pelvis. It's going to look like a hip stretch, but it's really what we're trying to do is take the two pelvic bones that come together. And if you think about when we walk, we do this reciprocal motion with our pelvis. One moves one direction, the other moves the other direction. So we're going to challenge that motion a little bit. We're going to be laying on our backs. Okay, one leg is going to bend up, and I'm going to grab just in front of my knee. And I'm going to start to gently pull that knee up towards my chest while I keep my other leg flat on the ground. So now my right pelvic bone is rolling back while my left pelvic bone stays rolled forward. When you get up a little higher, if your knee has to point out slightly to go further, that's okay. About a 5-second hold, and then I can switch. Right leg down, left leg up, and pull. And we're just going to alternate, again, about 10 or 15 repetitions all together, 5-second holds each time. And this is working on reciprocal pelvic mobility. Good. The next one that we're going to do is going to be looking at lumbar extension mobility. Most of us tend to get into a more flexed position through our back because we do a lot of sitting throughout the day. So what we're going to work on is the extension, especially in our lumbar and our low lumbar. And we're going to do this through a press up from our stomach. So I'm going to start laying flat on my stomach. My hands are going to be about at the level of my chin. And I'm going to peel myself off the mat. I want to think about my head lifting first, then my shoulders and chest. Then I'm going to push through my hands. And I try to keep my hips flat to the ground and relax my low back. Hold it a couple seconds, and then I reverse that. I lay my belly down first, then my chest, shoulders, head. When I go into the press up, I want my elbows to turn that crease of the elbow forward, and I want to be engaged through my shoulders. I don't want to be like hanging into my shoulders because that's going to just create discomfort up higher. So I'm pushing into the ground, crease of the elbow points forward, and hold, and back down. Okay? If you find it too difficult to do that without your hips lifting, your hands just slide forward a little bit. That's going to be a smaller range movement, and you just sort of find this point where you can just get into the position without your hips lifting. About a 5-second hold at the top each time. This one's going to be about 10 repetitions. If you feel that you have kind of an aggravated low back, if this causes any discomfort, try to keep the reps a little bit lower. It's okay to do it in chunks of like 5 at a time. But if you're not really feeling discomfort with it, if you just feel tightness, 10 in a row is fine. You could do that a couple of times a day. Next, we're going to do a rotation stretch so we can get our lumbar rotating and rotating opposite of our pelvis, which again is a reciprocal motion. That's an important motion during our gait cycle, during walking. So we're going to get into a position here, laying on our side. Now, you can do rotations with the knees bent up, and that will work the lumbar, but we just talked about the fact that we want to get the lumbar more extended. So what I'm going to do in this one is I'm going to take my bottom leg and I'm going to slide it back. So that's going to bring my low back into a little bit of extension. My other leg's going to stay bent up and forward to hold my hips in place. If I don't feel like I'm fully extended through my back, I can walk my shoulders back a little bit. We're going to start with our palms together in front of our shoulders. Top arm's going to lift, and I'm going to turn my head and watch that hand rotate. And then bring it back to the start. And we would just do repetitions here. Okay, if you feel like you lose the extension a little bit, just bring that leg behind you a little more. Walk your shoulders back again and reset. I would do 5 to 10 repetitions of the rotation on each side. So now that we've worked on the different areas that we have to get that movement mechanics for those joints, we want to look at some of the musculature that could be holding those joints in compression or out of good alignment. So the major one we're looking at here is the piriformis muscle. And the piriformis muscle is sort of a short triangular shaped muscle that connects our femur to our sacrum, and it runs through our pelvis. Now, our body uses it as a stabilizing muscle, and it's a rotator for our hip. The issue is that the piriformis attaches to the front side of the sacrum, and we have a right and a left piriformis. So if one gets overactive and is holding more tension, it's going to pull our sacrum into a little bit of a rotation or a torsion, and that's going to create one side of that sacroiliac joint getting more compressed than the other. This can often lead to compression on the sciatic nerve and lead to sciatica. On top of that, the sciatic nerve, the body of the nerve, runs directly underneath or through the piriformis muscle. Depending on the individual person's anatomy, it can be different. So if we have a piriformis muscle that's always in a little bit of spasm or tightness, it's always squeezing on the nerve. So we're going to end up with some more sciatica symptoms from that. So we want to make sure that we have a loosened piriformis, and we can achieve this just through some simple stretches throughout the day. We're going to look at how to do it laying down, and then for those of us who, during the day at work can't lay down on the floor, we'll look at a couple options, 1 or 2 options for doing it in sitting. So if we're going to work this on the ground, we're going to start laying back. We're just going to cross one leg over. If you have a really tight piriformis, if you cross your leg over and push on your knee, that might be a stretch for you. Okay? If it doesn't feel like much stretch, what we have to do is take our hips and bring them into more flexion while holding that leg in rotation. So what we're going to do is our hands are going to reach through, and behind this thigh, and I'm going to pull my knee to my chest. And what you should feel at a certain point is a nice deep stretch, sort of right at the corner of your hip and where your glute is. You'll feel that nice deep pull, and we're going to hold there. When I'm doing static muscle stretches like this, I typically say to hold it for 30 seconds and do 2 or 3 repetitions of that. Okay? Another option on the floor, again, kind of classic yoga type position. We can get into this S position with our legs. It's similar to like a pigeon stretch, and you can do a full-on pigeon if you get up on your back knee. You don't have to get all the way into that position. You can kind of just sit onto your hip. But this leg's going to be bent in front of us, and we're going to start to lean forward and bring your chest towards your knee and your shin. And same thing, you should feel that nice deep stretch kind of on the outside of the hip. Same exact idea, we would do about 30-second holds, 2 or 3 repetitions. Make sure to hit the other side here or up on the knee like a pigeon stretch for a little bit deeper stretch if you can do that. Okay, so those are options for when we have the ability to get down on the floor. If we don't have the ability to get down on the floor, then we can find a seat, whatever you have at work, a stool, a chair, a bench. We're just going to sit and cross one leg over, right? A lot of people probably sit this way normally when they're just resting. I'm going to make sure that I try to get my shin about parallel with the floor here, so I might have to push a little on my knee. And same thing, for a deeper stretch, I need to bring my chest closer to my leg, so I'm flexing at the hip. So I keep my back straight, and I start to lean forward into the stretch. This should get you a nice deep stretch, again, right in that corner of the hip. 30-second hold, 2 or 3 repetitions per side. This is pretty easy to get done during a work day. If you're having issues with this piriformis getting tight, I usually recommend you try to do this even up to 5 times a day. Now, once we've gotten the piriformis to loosen up, it's not going to stay loose unless we can correct whatever was causing that side to get very tight. So again, the piriformis can help with stabilizing our hips, sacrum, pelvis, but it really isn't built to do that. So what often happens is we have muscles that are not activating enough, and the piriformis has to help them out, and it gets overworked and it gets tight all the time. So stretching is great in the short term, but it's not going to fix your problem. It's a Band-Aid right now. So what we have to look at is building some strength into the glute muscles. So the first glute strengthening exercise we're going to do is going to be a bridge, but we're going to put something between our knees to give us something to squeeze into. The idea here is if we can push our knees together into something like a yoga block, or you can use a soccer ball, a basketball, anything like that. If we're pushing our knees together, if you think about your femurs, if the knees come together, the tops of your femurs technically would spread just from leverage. We're kind of thinking in like a biomechanics sense here. So if the tops of the femurs are trying to spread, they're going to pull on the pelvic bones that they are attached to via that hip socket and all the ligaments, and it's going to pull those pelvic bones apart slightly. Now, when you pull those pelvic bones apart, your sacrum, like an upside down triangle, is sitting in between those two bones. And so that's going to gap open the sacroiliac joint where the sacrum meets the pelvis on each side. And then as we go through the bridge motion, we're pushing our hips and our low back into extension, and we're getting that sacrum to flex and extend. So it's going to promote more motion out of the sacrum. And this can actually help sometimes if their sacrum is stuck in a torsion. It opens things up and you move it back and forth a handful of times. Sometimes you can correct those torsions. So it's sometimes called the shotgun technique for sacroiliac dysfunction. So what we're going to do is we're going to get onto our backs. We're going to place the block right between the knees. This gives you something firm to press your knees into. So I'm going to give it a nice moderate squeeze. So if I'm thinking about as hard as I can being 100%, I want to squeeze about 80%. I'm going to squeeze the knees together and hold, and then I'm going to start to lift my hips up as I keep that squeeze between the knees. I want to see a straight line from my knee to my hip to my shoulder at the top, and then I come down slow and controlled, holding the squeeze in my knees the whole time, and then I can let the knees relax a little bit between the rep. And then I'm going to reset. So I squeeze the knees together, 80%, lift the hips up, straight line from my knees to my shoulders, back down slowly. We're going to go for about 10 repetitions on that. If that didn't feel too hard, we're going to progress to a harder version of a bridge here. So what we're going to do for this next one is we're going to bridge the hips up, and then I'm going to lift one foot, and I'm going to kick that leg straight out. My thighs should stay parallel to each other. My foot comes back down. I'm going to switch now. I keep my right foot on the ground. My left leg extends. And I come back down and lower. So that's one repetition. We can try somewhere between 5 to 10 repetitions with this. What I don't want to see when people do this is if I lift one leg up, I don't want my pelvis to drop. I need to keep my glutes activated enough to keep everything in line there. And I switch, and I lift, and I don't let it drop. I keep it elevated. All right, so hopefully that's helpful for some of you. The caveat here is that this can help you with some mild sciatica symptoms or help prevent it. But as you can see, there's a lot that's going on that can lead to sciatica. There's different sources of where nerve compression can happen. And there can be different alignment issues and different muscle imbalances. These are just kind of the common things that I see. So really, if you're having an ongoing problem or you're having a more severe sciatica problem, it really pays off to see a good therapist who can do a full evaluation of your movement mechanics, of your alignment, and figure out specifically where your issues are coming from. I would consider this sort of the shotgun techniques for sciatica. Really, we don't want to use the shotgun. We want to use the sniper, though. We want to figure out exactly where the issue is coming from, correct it, and make sure it's not going to come back. So try these things out, see how it feels, and if you're looking for somebody to help you figure out the deeper root cause of what's going on for some of your pain, talk to us at Integrity Physical Therapy, and we'd be happy to help you out. Thank you.